Hey everyone, welcome, welcome, welcome to today's live stream. I'm excited to have you all here today. If this is your first time joining the live stream, hey, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in medical coding career, help people pass their certifications, build a career that they love, and make sure that they're avoiding all of the little things that can trip you up or confuse you along the way. If Today's live stream is going to be a good one because we're going to talk about how to break into medical coding, how to study for certifications like the CPC, and honestly, how to go from like, what is this? Where do I even start? How do I get training to like, okay, I think I can actually do this to, okay, now I think I need to get certified. Is this certification right? And like the whole gamut of the journey. Can you guys let me know if the video looks okay? Because I just realized I forgot to plug myself directly into the internet and I might need to go do that while the theme song is playing today. I know I'm actually here live today. My energy crashed a couple weeks ago, so I skipped the past couple of weeks. But yeah, whether you are new and you're just exploring, or you're studying, or you just want to feel a little less overwhelmed, or make sure that you're not going crazy, or you're trying to figure out your next step, you're in the right place. We're going to dive in. We're going to talk about lots of things surrounding medical coding and careers and all that. But let me know in the chat where you're tuning in from today, where you watching from, where you are in your medical coding journey. And then don't forget to hit me up with a hashtag replay if you are watching the replay crew so I can show some love to the people that are watching the replay. All right, without further ado, let me get the intro playing and then I will head over to plug myself directly into the internet so we can stop being so blurry. Give me one sec, guys. Here we go. All right. That should be better now. I got me off the Wi-Fi and plugged directly in, which should help with everything being really blurry. I had forgotten like how bad it gets when I'm just into the Wi-Fi. I hope TikTok is looking okay now. Instagram is showing me super blurry, but hopefully it looks better now from you guys. Okay. My gosh, my brain is fried, and I'm gonna be super duper honest with you guys. It's because my brain, I turned it into, playing Pokemon Pokopia for the past, I don't know, 2 weeks or something. Still blurry. Let me see. Let me do one thing. Maybe if I take myself off and take it all back on. Yeah, it's still showing blurry on Instagram too. That's so strange. Do, 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 do. It should be better now because we're off the Wi-Fi. This is what happens when I don't stream for like 2 weeks. I forget how all the bells and whistles work. Let's see where we are here. Microphone, volume. Yeah. Okay. Let's get into I got my friends from TikTok. They're just kind of coming in and out. They're joining in and out. Let me see if I can share screen over and get into some other stuff and see if that'll fix it. Okay. There we go. Getting me out of there. All right. So today's video is sponsored by Preppy. If you're not familiar with Preppy, they are an on-demand medical coding training program that I do recommend. So if you are looking into getting into medical billing and coding and looking for an easy and on-demand way to get trained, check out Preppy. You can find out more at startmedicalcoding.com, or you can go directly to preppy.org, but you can save $100 on Preppy when you use my code Contempo at checkout to save $100 on training when you pay in full. Now, hopefully, the video is looking a little less blurry now. Let me check over on my IG people. Maybe they're saying it's still blurry. That's so crazy. Let me do one last thing to see if I can get the blurriness to stop. Hold on for 1 second because I'm going to close out and then go back in. Okay. Oh my gosh, this whole thing is acting crazy now. Hmm. Maybe if I. There we go. Okay. Whew. Let me know if it's better now. I am so sorry. Um, Tara says, my question is about the Preppy program. I know that their program does not include the books, only ebooks. So, yes, you do get ebooks, not physical books. Also, AEPC membership is not included. Do you really think that their program would suffice for learning coding? Because I'd still have to pay for books and membership. I think they are a fantastic program. I think you are unlikely to find another program that is going to be as budget friendly, that's going to include what you need and not cause you to overspend. You could go through other programs if you want. If you're like, "Hey, Victoria, I don't like that you have, an affiliate relationship with Preppy, that makes me feel uncomfortable." Or you're like, "Hey, I want all of the bells and whistles. I want paper books. I want my membership included. I want my exam fee included." What you need to understand is that when you get more add-ons, those programs are going to cost more. The exam fees are more than $400, I believe, for one attempt. If you want paper books, there's cost of printing those books and shipping them out, so that's gonna increase your cost. So you can go with other programs that are going to include paper books, that they're going to include membership, that they're going to include the certification, but then you're also at risk that let's say you get to the end of it and you're like, "You know what? This really wasn't for me." Well, now you had to pay for membership and certification that you might not wanna wind up using. So what Preppy does is they take those out so that it's more affordable and budget friendly for everyone. Let me check one more thing. Everyone's saying the video's still blurry. Mm, I don't understand why, because it's not showing on my end blurry and lagging. Um, okay, let me completely shut down and restart. You guys are gonna have to hold on for about 3 minutes because that's the only other way I can fix, I think, the blurriness. Give me 1 sec. All right, we're back in hopefully with YouTube and Facebook and LinkedIn and all that good stuff. Possibly not Instagram though anymore. I think I may have lost them because of the stream key stuff going on there. But any case, um, yeah, let's see here. I should be looking better now as far as that. And I apologize if the internet was acting a little crazy right there. All right. Where are we? So yeah, if you compare going back to the Preppy question that Tara had, if you compare pricing, let's say you are like, "Hey, you know what? I want the paper books, I want my membership, I want my certification fees." Even if you add those in to the cost of training for Preppy, it still comes out a lot less than other programs, and you get a lot more because they offer a ton of career support and stuff. Yay, thank you. I'm no longer blurry. I'm excited. TikTok has no idea what I'm talking about. They've been streaming on a totally different platform than the rest of y'all. But yeah. So that's what I would say. Um, Other things you could consider is check out your local community colleges. There's a lot of colleges that might be near you where you could possibly get grants from the state or the government. You might have tuition reimbursement from your current employer. So maybe you have somewhere that they say, hey, you go to this college or you can take this online training and they heavily discount it. So look into those options as well. I'm going to make some more videos for self-study. And perfect timing. Starting preparation in a few days. One advice for self-study. So there's a difference between self-study and taking a self-paced program. So if you could just clarify if you're really referring to self-study, like I'm not enrolled in a program, I'm doing this on my own, or if you're doing a self-paced program, because I think sometimes people confuse those two and they tell me they say self-study, but what they really mean is they're in like the AAPC's self-paced program where they go through the modules themselves. Now, curious if I brought my new step-by-step book. It might still be in my other office. I'm going to be sad if it is because I wanted to make a video on that today. But yeah, if you want to self-study, what I recommend is these books. They are called Step-by-Step Medical Coding. They're by Bucks. You can find these on Amazon. You can buy the ebooks on Vital Source Bookshelf, which is great. I want all ebooks because you can do ebooks for the AAPC and a lot of the other programs out there. Vital Source Bookshelf. I thought I was lagging and something just popped up on my screen. Okay. Let me get that out of my way. So these are great. And one of the things I like about the step-by-step books is they'll give you kind of like a free course. It's not like a video lecture course, but it is like things you can click through to follow along as you self-study. The book that I recommend along with this, if you don't know MedTerm, is there's a book called Medical Terminology and Anatomy for Coding. I'll pull that up so you guys can see it. Because it's better instead of diving into medical coding. If you don't know MedTerm and anatomy, you really should study that first before you start getting to the coding components of it. And I think I do have these in the storefront. No, the 23 is not the newest book. They come out with new books every single year. This is just the paper one that I happen to have by me right now. So get the 2026 edition. So this is the book that I recommend for MedTerm. I think there's a newer version. I think there's a 5th edition now. Yeah, here it is. Either one is fine. The only difference between the newest edition and the older editions is that the older editions might have some code changes in it because anatomy hasn't changed. Med terminology hasn't changed. So that component is still all the same. It's just that every couple years they update the medical coding concepts for it. For MedTerm and Anatomy, and then get the current year edition of the step-by-step medical coding books for self-study. Get the little mini course that comes with them, usually on the wrapper or somewhere on there. It has this access code to get into the little mini course. And those are the best books for self-study. Now, the thing that people do complain about in regards to the step-by-step medical coding books is not all of the answers are going to be there. You will get maybe 70% of the answers. So 30 to 20% of them are not going to be in the book. They won't give you the answers to all of the coding question scenarios. The caveat to that is you will not find a better book to learn medical billing and coding. You could go out and buy another book probably that someone slapped together on the internet that has all the answers you want in it, but it's not going to be as good to teach you medical billing and coding. Miss Sweet Thing says, if I have the coding books, would I need those books too? Yes. So these are textbooks. The code books themselves do not teach you how to code. They give you some basic lookup instructions, but as far as how to code, how to understand the insurance concepts, and really be prepared for certifications, which is what employers are looking for. They want to see you have a certification through AAPC or a HEMA if they're going to hire you for a medical coding job. They're going to, these textbooks are going to teach you how to do medical coding. The code books themselves will not teach you medical coding. So you need to have the textbooks, you need to have a textbook, and you need to have the code books too. So you need an ICD-10-CM, a CPT, a HCPCS book for like CPC or CCSP. There's also a step-by-step workbook. So these are just practice cases. And that's a supplement as well. But again, the workbook does not teach medical coding. The textbook is what teaches medical coding, the big, fat, thick one. So you would need at a minimum a textbook and all of the medical coding books in order to learn medical coding on your own. I would not recommend getting the 2023 one. You should buy the 2026 one. That is the most current year. Again, this is just, I have the paper 2023 here. That's why I'm showing it. Get the 2026, the most recent year's version. You can buy them on Amazon. You can buy them on a lot of local bookstores. Some libraries do have them available to borrow. You can also, if you want an ebook, I would suggest Vital Source Bookshelf. You can buy the Vital Source Bookshelf ebook version. And that's what I would recommend. The author of Step by Step Medical Coding, it's by Elsevier. So it's written by Bucks. See, it says Bucks right here. Bucks. But yeah, you can find those two on Amazon. You would just go in Step by Step Medical Coding. And then there's the code books. Okay, so here, the one that's 109 on Amazon, that is the textbook. And then there's a workbook. So this is the workbook. That's just practice cases. This one is to learn medical coding, the textbook. The workbook is for practice scenarios. There's another book out there that sometimes I think people get confused with. I can't remember what it's called. I know there's an advanced one called The Next Step. Oh, Exam Review. So this would not be a good textbook for learning medical coding. This is just, hey, I'm preparing now for certification and focusing on this, what I need to know for the certification. This is not the same as the textbook to learn medical coding. Where is my mouse? There we go. Question coming in. Hello, I'm Brand. Being new, I want to be a medical coder one day. I understand being a medical coder is different than a medical biller. Work from home, any possible flexible opportunities with employers, or be independent. I think there's a lot of remote medical coding jobs out there. The latest EAPC salary survey said, I believe it was 70% of medical coders are working from home. There's a chunk there that are working partial from home, partial on site, and then a small percentage of they're just working on site. So the majority of medical coders are working from home in some capacity. There is a lot of flexibility with medical coding. It's not as flexible as like, hey, just work 40 hours a week and we don't care how you get it done. Most employers are like, hey, the earliest you could start maybe is 5 a.m. and the latest you could start is 9 a.m. We want you to keep kind of the same schedule every day, but if you need to leave early or work late, just let us know and we'll adapt. But it is typically an hourly position. It is one where you are expected to have productivity and accuracy. I say that because I know some people, they're like, "Hey, can I stop at 9 a.m. every day and drop off my kids and go through the car line?" That is really employer dependent. There's a lot of employers that are fine with that kind of thing. However, they're not usually as cool with, "Hey, I'm going to homeschool my kids while I'm working home as a medical coder," because of those productivity and accuracy scores. It's really hard to keep that focused attention and make sure that you're keeping up with the productivity and with the accuracy while you're being dragged off to do other things. That might be different, if you have older children who are more independent and stuff, but they don't typically allow caretaking while you're working as a medical coder. Um, Maddie says, "This is silly. The guidelines, the ones in the beginning of each chapter, can I use those and not in the front?" They are exactly the same. So it depends on where you want to flip to. So what Maddie's referring to is the ICD-10-CM code book. Oftentimes, I use the one from the AAPC, and oftentimes other publishers lay out the same way. We have at the very beginning of the book all of the ICD-10-CM guidelines. So right where? It's on my top tab. I'm looking at my side tabs. So here's all of our official ICD-10-CM guidelines. So the entirety of the ICD-10-CM guidelines. The chapter-specific guidelines, though, are published at the beginning of each chapter. So, for example, if I want to go to the chapter on neoplasms, all of the chapter-specific guidelines are at the beginning of that chapter. And again, these are just the chapter-specific guidelines. So it's not going to include the general coding guidelines. Those are only going to be in the guidelines in the front. You can reference either of the chapter-specific guidelines at the front or in that chapter. They are exactly the same, but just keep in mind that these are only the chapter-specific guidelines that are going to be at the front of each chapter. So, for example, the respiratory system, all of the respiratory system guidelines for that chapter, the chapter-specific guidelines are going to be at the front. Not all book publishers do that. I know AAPC does. Optum, I believe, does. There's a lot of different publishers of the code books. I even get this. I don't even remember buying this, but I have an Optum version of the CPT Expert from 2025. But yeah, so you have to be very careful with the different publisher versions of the code books. Some people, they get different versions and then they're very confused because they're trying to follow along with mine, but I might have a different publisher version. There's all kinds of different publishers for ICD-10-CM, for CPT, for HCPCS. They all have the same content, probably just organized different ways, different highlights, different icons. Some might have more illustrations than the others. Some might have some different appendices or different clarifications on things. So this one you can see, it doesn't have a spiral binding, so it's a cheaper edition. If you are sitting though for the CPC exam, there is a very certain edition of the CPT book that you have to have. It has to be the AMA edition only. So it has to be current year or prior calendar year of the AMA edition of the CPT book. You can bring whatever version, current year or prior calendar year of ICD-10-CM or HCPCS you want, meaning any publisher version, AAPC, Optum, Bucks, AHIMA, PMIC. Those are just a handful of the publishers out there. But yeah, you can bring whatever ICD-10 or HCPCS, but the CPT has to be the AMA edition for the certification exam. Do the tabs come along with the book, and how do you figure out where they go? So I have some videos on the YouTube channel specifically about tabbing. There are tabs that are included with the books. They're not the greatest tabs out there. I might have one on my shelf here. Oh, I do. So this is one of my older ICD-10-CM books. These are the tabs that come with the book. They're these little flimsy yellow things. They're perfectly fine. You can use these. There's nothing wrong with them. But you can see the ones that I have in my new book are a lot cooler looking. These I actually purchased on Etsy from a seller called Medical Coding Tabs Co. If you go to my tabbing videos, I believe there is a product link there to exactly where you can go to purchase these. And I'll put it in the video after the fact too for anyone watching on the replay. But these, they're a lot more color coded. The text is better. It's easier to read. They're organized better. They give you a template of like exactly what pages to put the tabs on. So it's an added expense. It's not worth it for everyone, but for some people it is if you want to have really cool looking tabs. And again, that's Medical Coding Tabs Co. on Etsy. Rose says, your videos help me prep for my test, just waiting for the results. Hopefully you get them soon. You're in a good time right now. There are certain times of the year where it's a little longer of a wait to get results, but right now it shouldn't be too bad. You should have them soon. Anna Copeland said, what are some productivity metrics for starting out in medical coding? I'm going to tell you what a lot of people online are going to say, and that you really can't tell. Productivity it varies so much that I can't tell you it's going to be 10 or 12. I can't tell you if it's going to be 15 or 20. It depends on so many different factors. What type of coding you're doing, what specialty you're working in, how fast is you receiving those records? Are you just having access to everything in Epic? Are there certain things that you have to access different systems for? Do you have to look at paper charts because you have a provider that's still rounding in a nursing home somewhere where he's just writing down notes and they get scanned in somewhere? So it depends on a lot of different factors. So there's really no threshold that I can give you. There's some old AHIMA benchmarks, I think more so maybe for inpatient coding. You might be able to find some things for like E&M. So if you're just coding evaluation and management, some people might say it's like 15 an hour. But again, it really depends. Are you just coding CPT? Are you including the ICD-10-CMs? There's really no way to say for sure what the productivity standards are going to be. I will say, however, if you are just starting out, they're not going to expect you to be at top tier productivity right out of the gate. They're going to give you a nice clearance. They're going to give you like a 90 days, like, hey, we just expect you to get a couple done. We're more so worried about accuracy than we are productivity in the beginning. But then as we go on, we want to see that, as you're getting more familiar with the systems, you're able to get it done a little faster. Do I recommend the Bucks studying books versus the AAPC books? I do really prefer the Bucks books. The AAPC books, I think, are good, but I just think Bucks are better. One thing I will say in regards to the AAPC books is if you are looking for a textbook to study for medical coding, like if you're studying for the CPC exam, the only way you can get that textbook, assuming you can't find someone who has an old one that they're willing to sell to you, is to purchase their training course. So if I go to the AAPC's website and I'm just like, hey, you know what? I'm not going to pay for their training fees. I'll just buy the books and do it myself. That's not an option. The only way you can obtain those books is if you purchase a full training program or you find a used one at a bookshop or something somewhere. So let's get into this shop. Um, books and guides. So let's say I'm like, hey, I'm going to self study for the CPC exam. What they're only going to be able to offer you if you're not in a full training program is a study guide. So, exam preparation study guide. So, these study guides are not full textbooks, they are very condensed. They are maybe 20% of what's in the textbook. So they're not like a good book to learn medical coding from. These study guides are more so focused on, okay, now you've done your foundational training. Here's the things you need to hone in on in order to pass this certification exam. Here are the concepts. Here are the um, things that we're commonly going to test on, and that's what's in these study guides. But again, they are a very condensed, like 20% of the content that's in the textbook, if that. So you cannot purchase just the textbook outright like you can for the Bucks editions. Well, they'll just let you buy the textbook. Now, if you're enrolled in an AAPC program and you already have access to all the materials that they've provided for you, you don't necessarily need to go out and buy the Bucks books as well. You'll have everything you need included with their training program. If you're like, hey, I want some extra though, or hey, this book is just not, it's just not meshing with the way I learn. I think I want this structured a different way, then pick up the Bucks books if you have the budget for it. But you don't necessarily need it if you're already in an AAPC program. Jess says, have you heard of anyone being able to work overseas? I've been CPC certified for 9+ years and we're looking to move to Thailand. I will tell you, yes, there are medical coders that do work in the Philippines and Egypt and Pakistan and India. However, typically when hospitals and healthcare apologize for that, they are typically doing that because of cost savings. So they're only considering hiring coders from outside of the United States to work within companies for the United States if they can save a whole bunch of money. So while you might still be able to find a coding job if you relocate to Thailand, they're not going to pay you what they would pay a US coder. Anthony asks, is the CRC exam much different from the CPC exam I'm thinking of going for? It is very different because there's no CPT questions on the CRC exam. It focuses primarily on ICD-10-CM coding, very in-depth ICD-10-CM coding. They're going to test on concepts in coding, coding clinic. So things that are high dollar, high expense medical diagnoses, and then risk adjustment processes. If we go actually on the AEPC website, we can see the exam breakdowns of both of those and see what the difference is. So if you ever want to see what is the content for a certain exam, what they're going to test you on for the AEPC, the majority of certifications do have an exam breakdown online. The specialty ones don't usually because they're just going to be whatever concepts that specialty relates to, but most of the core credentials do. So if we take a look at the CPC exam and we go to take the exam and we scroll and scroll and scroll to the bottom, it's going to tell us the breakdown of these 100 questions that are going to be on the exam. What are the concepts they're testing us on? So med term, anatomy, compliance, coding guidelines, there's only 5 questions that are specifically on ICD-10-CM for the CPC exam. And then it gets into HCPCS and then a ton of CPT and then 10 cases. However, if we look at the CRC exam, Certified Risk Adjustment Coder, and we go to that certification and take a look at it, take the exam, and then again, scroll. Breakdown of the 100 questions for the CRC exam. So we have 15 questions on compliance, 30 questions that are just on diagnosis coding versus the 5 we had on the CPC exam. They're specifically going to tell you it's going to be mostly these concepts: amputations, CHF, CKD, again, those high complexity, high dollar diagnoses. But then they're also going to test on documentation improvement. There's going to be some path, medterm, anatomy, purpose of risk adjustment models, quality of care, risk adjustment models, and then 10 cases. So there is quite a difference between what they're testing you on for the CRC versus the CPC. If you already have a CPC, it's not that far of a jump to go and get the CRC. A lot of people can make that jump with just a study guide and my review course. If you want to, I have an amazing risk adjustment review course for specifically the CRC exam on my website, contempocoding.com. You can save 50% if you would like to use code YouTube50 at checkout. And again, that's code YouTube50 at checkout, and it will save you 50% on the risk adjustment coding review that I have. So the review, the study guide, a lot of people who already have their CPC can do really, really well with that. There are full training programs out there with the AAPC. They're kind of pricey. If you want more in-depth training for CRC, the other person I would definitely recommend is Danielle Bagnell. She does amazing training for basically anything. She's great. But she does a lot of risk adjustment stuff. And I know she does reviews for the chapter sometimes. And I also just did a video last week on the top missed concepts for the CRC exam. Allison Rice says, please tell me the CPC exam, they won't be asking questions on ICD-10 PCS. There are no PCS questions on the CPC exam. So CPC is Certified Professional Coder, which is pro-fee coding, billing on the CMS 1500 form, which does not involve ICD-10 PCS, inpatient UBO4 DRG type coding. So you don't need to have a PCS book for the CPC exam. You're not permitted to take one with you. You wouldn't want to. There are no PCS questions on the CPC exam. So a lot of programs do include a little bit of PCS just to kind of get you familiar with what it is. But yeah, the CPC exam doesn't have any kind of inpatient coding stuff on it. This comment says, I use Contempo coding material for my CPC and CRC. Great resource for me. Awesome. Thank you so much for that compliment. Ali says, do you know of any free courses for medterm and anatomy? I've heard some people say that their local colleges or libraries might have ones that you can enroll in for free. If you go on YouTube, there was one. I haven't really checked in the past couple of years, so there might be better ones, but I know JJ Medicine used to be one. There's also Crash Course with the good old Hank Green. He does some amazing stuff on anatomy. But I think medterm and anatomy is one of the easier ones that you can learn for free because it is more general concepts, and a lot more people can cover that without having to worry about things like copyright infringement or that kind of thing. Hi, I'm so lost when it comes to guidelines and how to remember. Any tips, please? I bought your notes and have been putting them into my books. I'm not quite sure what you're referring to because I don't sell notes. Unless you're referring to, I have like one in my CRC course that I have a couple of notes. But if you're talking about the CPC exam, I don't sell notes. Maybe you're thinking of someone else? Do you recommend the medical terminology flashcards? I do have a set that I recommend that I really like. Where are they? I think I have them on my other shelf, but let me grab them and I can show you the flashcards that I like. You can always make your own for midterm. But that's a lot of handwriting. So let me show you guys one sec, the one that I have. There we go. Okay. So these are the ones that I have. They're medical ter where did my TikTok go? No, I lost them. Oh, there we go. I don't know what the heck, you guys just disappeared on me. Um, so medical terminology flashcards, these ones are from Quick Study. You can find them on the TikTok shop. I think they might be cheaper there. They are also on Amazon. That's where I got mine from. But they're pretty great. They're not like super cool laminated ones or anything, but I like them because it covers a lot of the prefixes, suffixes, root words, and they cover a lot of different terms. So let's see here. We have humero, which is the humerus. That's the bone here. Hydro, meaning water. So they have the term and then what it means on the back. And there's a ton of them. So it's a lot easier to just purchase these than it is to buy 6,000 index cards and do them yourself. So these I think are a great resource. Again, not necessarily needed, but if you're a flashcard person and you like them, I like the ones from Quick Study. They come in a nice sturdy box, so you can probably not as easy as just pulling out your phone and just studying with something there. I don't know of any apps off the top of my head. I'm sure there's plenty out there. You could probably just check the ratings for them and see if there's like a medical terminology flashcard stuff. I'm sure there's plenty though. These are the medical terminology flashcards from Quick Study. There's 1,000 cards in there. Yeah, Rose says she uses Quizlet on her phone for flashcards. There's a lot of Quizlets out there. You do have to be careful though if you're doing Quizlets specifically for medical coding, because there's a lot of stuff out there that's either outdated or was pulled from outdated information. There's been issues in the past with people finding old exams or quizzes from instructors from 2016 and then just putting them onto Quizlet or putting them onto those, what are those websites called where they're basically designed for students to cheat on their exams and stuff. I can't think of the name of them because I don't go to those websites, but people will put old, outdated information on them, and it's not accurate. It's not up to date. It's not what they're currently testing on for the exam. So you do have to be careful when it's medical coding specific stuff. Medical terminology, anatomy, that's usually safe. Pharmacology is usually safe, but the med coding stuff, and we're also in an era right now where people are just using AI to generate garbage that's not accurate so that they can sell Course Hero. Thank you. That's the name of it. So that they can sell crap and not put their name behind it. So that way people can't complain. They have nowhere to direct complaints to when the study guides and things that they're selling are not good. Jess says, I'm new here. Could you share how you started your medical coding journey? Your content is superb, and I aspire to be as well educated as you. So, my journey was a while ago, so it would be very different than it would be today starting medical coding. But when I started out, I went to my local community college, which is Reading Area Community College, if you're familiar with Northeastern Pennsylvania. And I was going to go for, I think, their medical secretary program. And I was going to go for my associate's degree. And one of the girls stopped me there and she goes, "Okay, well, if you're doing this because you want to do medical billing and coding, you don't want to be here. You want to be across the street at our career center because we have a program there specifically for that." So I walked across the street and got signed up for their billing and coding program. It was a lot cheaper than, I think it's several $1,000s now. And Reading, if you're familiar, is a very impoverished area. So I learned the basics of med-term. I didn't even have a med-term book. I just had a nurse that wrote all of the different terms on the chalkboard every day, and I had to copy them down, and we'd go through 20 different terms or so, and then we'd take a quiz on it. It was very rudimentary. Um, when I got into medical coding, it was more billing geared. So we also again had a nurse teaching us medical coding who had not super worked a lot in medical coding and didn't always necessarily teach us correctly, um, or understand the coding concepts. But I passed it. I did really well in it. I didn't have a code books at the time. We basically borrowed old code books that were donated and kept in a bookshelf in the back of the room. But I did an internship at my local healthcare system. They had just formed their physician group because this was back in the era where, everyone was being forced to go on electronic medical records. They didn't have the resources. They were forming these physician groups. They were getting bought up by the hospitals and they needed people. So I started out doing basically charge entry and was hired on there doing charge entry. And then they're like, "Hey, we need some coders. We'll bring in an AAPC instructor. And if you pass your certification exam, we'll reimburse you the cost for training." So I got my code books and my training books and went to classes to learn medical coding, passed my certification, got reimbursed then for all of that. And it still, even after that, took a couple of years till I was really working as a medical coder. I wound up taking a second job in the evening teaching medical codings at a local tech school and got some experience that. My day job, I could not for the life of me move up though. Every time it was just some kind of weird situation, "Hey, we're taking this job down that you applied for," or "Hey, we hired someone else who doesn't even have certifications and isn't interested in being certified." Um, so I switched that job. I went to go work over in Allentown instead and in revenue cycle, and then transferred over after, a handful of months to coding for hospitalists. I'd been doing that for a while. Then I got my auditing certification. I got some specialty certifications and just kind of built up from there. That was kind of the end, though, of my employer reimbursing me for anything. Everything else was kind of to my own benefit. Um, and then one day I was just reading, the AEPC magazine, which back then I can't remember if it was called Coding Edge. I think it was still called Coding Edge back then. And decided, you know what, I could probably write an article on the specialty I was working in and wrote an article and they said, "Hey, would you like to also come and present on this topic at HealthCon?" And that's what I did. I went out to Vegas that year and presented in HealthCon and got involved with my local chapter and really built up a pretty great career from not much. And one of the things I really want to stress upon when you are someone who is ambitious and looking to grow in this career is do it for yourself. Don't wait for your employer to come by and go tap you on the shoulder and go, "Hey, don't forget to get your auditing certification," or, "Hey, I think you should do this," or, "Hey, I think you should do that." No one told me to write an article. No one told me to go speak. No one told me to be involved in my local chapter. I just looked out and well, what are the people who are successful in this field doing? And I'm just going to reverse engineer that. Someone has to write the articles. And this days, it's a lot easier to write. Back in my day, you had to write everything from scratch. Now we've got a lot of tools that can help, you know, uh, jumpstart you. I mean, obviously, they don't want ChatGPT written articles in the magazine, but you can start brainstorming topics. You can get bullet points of what topics to cover that maybe you hadn't thought about. You can have it edit your stuff for you, fancy it up a little bit. But the editors there are fantastic. They make everything amazing. But yeah, if I was doing it all over again today, I would probably go through an online program like Preppy where I don't have to don't have to park in the city and sit at an uncomfortable desk and borrow old outdated books from a bookshelf and all that. Um, but yeah, Preppy is good. There's a lot of great options out there right now that are on demand. I actually, you know what? I might have, if I was totally restarting from the top today, I would probably go through a program like Preppy, get my certification. And then I think if I was restarting today, like I might go back and maybe get my associate's degree or maybe go even for my bachelor's. WGU has great, great programs if you're interested in getting like a college degree, which you don't need to in medical billing and coding. But if you're interested in a college degree, a lot of my friends went through WGU and did phenomenal because they have a very flexible, structured program. Marcy says, do you find it hard to get a job even with certification? I got medical billing cert and can't get a job. So it depends. You have to have the right certification. So not all certifications are considered equal. Employers are really looking for certifications through EAPC or AHIMA. So if you have something from like NHA or one of the other organizations out there, like the CBCS, that's not really going to work for medical coding jobs. Medical billing jobs, yeah, if you have the training and stuff to back that up. But for medical coding jobs, they really want an AAPC or an AHIMA credential. So having said that, the job market right now is just in general not great. I don't think medical coding is any better or worse than what's standard right now for just the job market as a whole. I don't think there's a ton of jobs that you would find right now that you would go online and people are like, jumping up for joy at how easy it is to find a job in there, short of maybe the trades or, nursing, something like that, something where you're doing more clinical work or hands-on work. Everything else right now is very difficult. And I don't think medical coding is exempt from that. I'm not going to sugarcoat it for you and go, yeah, you're going to get a certification and that's your golden ticket and you'll easily find a job. You'll definitely, if you have the CPC or the CCA or the CCSP or the CCS, it'll be easier to get that foot in the door. But you do still have to have a strategy for it. You do have to have your resume up to date. You do have to network. You do have to get involved with your local chapter, and that will help handle some of those challenges and provide some better opportunities. Question here says, do you need the 2026 books for the COC? So any APC certification exam that you're sitting for that allows books, because there's a couple certifications that don't allow books. Your books have to be either the current calendar year or one calendar year prior. So for 2026, you can use your 2026 books for the entirety of 2026, or you can use your 2025 books. You can't use 2024, 2023, 2022. As we get later in the year and they start publishing next year's books, you also cannot use 2027 books until January 1 of 2027. You can't use future years' books. So always with the certifications, if you're allowed to use your coding books, they have to be either the current calendar year or one calendar year prior. Now, when you're contemplating that, hey, what if you only have 2025 books? What do? You can just bring your 2025 books and use them. Some people attempt to write all of the new codes in their older books. That is an option if you don't have the budget to purchase new books. Some people don't want to have to purchase a new book because they have so many notes and highlights and colorings and all kinds of things they did to their older year book, and they don't want to have to purchase a new one. So maybe they just are like, hey, I'm going to make do with this. There is a little bit of a risk there. So obviously every year codes change. So the exams change a little bit. Now they're not going to rewrite the entire exam in order to accommodate the new codes, right? They're going to look at everything that's already in the exam bank and in their content, and they're going to go, is this still accurate? And if something is not still accurate, then they'll just update that for the updated codes. It's not like they're like, hey, we've got 400 new ICD-10 CM codes this year. We're going to make 400 new questions for the exam bank. That's not what they're going to do. They might make a couple of new ones for the new codes. More so, they're going to take the older ones and make sure that they're still accurate. And if not, they'll update the codes that need to be updated. So the other option you have is you can use ebooks. So if you have an exam voucher for the CPC or the COC or whatever certification exam, when you redeem that, part of that redemption is going to have a interface where it asks you, are you going to bring your own books? Which then you have to make sure that you have the correct editions of the book, correct years, and you're like, yep, I'm going to bring my own paper book. I'm going to make sure that they don't have anything in there that I'm not supposed to, like loose pages or sticky notes, or that I didn't write practice exam questions in there. And you have to be responsible for bringing your own books. The other option when you redeem your exam voucher is you can elect to use ebooks. When you elect to use ebooks, they will automatically embed the correct books into your exam platform. Problem there is you're not going to have your notes, you're not going to have your highlights, you're not going to have your fun tabs on there, but you also don't have to drag a whole book there, and you have a search function. So there is a little search bar in the book that you can search for different terms. You can search for the codes themselves, which is great for multiple choice. Because a lot of times, what's the answers to the question going to be? Is it a 99212, 3, or 4, or 5, right? So you can go search 99213, pop right to the code, look at that and go, oh yeah, no, it's 99214, and then answer it and be on your way. So that is an option. None is inherently better than the other. It's not like, oh, the ebooks, you got to use those because you're going to have a better chance of passing. Some people don't like the ebook. Some people like their paper books. Some people don't want to have to purchase new books. There's just a lot of factors to weigh. So none is inherently better or going to give you a better chance at passing. Please give me quick tips. I'm going to write the CPC exam on April 8th. Okay, so here's what you need to do. What you need to do for the quick tips is we're going to go to the Contempo Coding YouTube channel, and we're going to find the CPC exam playlist. So here we are, Contempo Coding on YouTube. And we're going to go down to some of these playlists, or you can just click the playlist tab here. And you're going to go to CPC exam tips. That is all the tips I have, my guy. The first video here, this is the number one video that you have to watch. It is the most important one. I've had people tell me that they would not have passed the exam if they had not watched this video. And that is the most missed CPC exam questions and how to get them right. These are the concepts that are most likely to appear on the CPC exam that trip people up, not the questions themselves, because they might have a question that tests you on twin deliveries in obstetrics, and they might have 6 different variants of questions about that. So it's not like, hey, memorize this question. It's you need to learn this concept, because they might have 6 different variants, 7 different variants in their exam bank, and you don't know which one of them is going to be embedded in your exam that you're going to get randomized out of their huge, huge, huge exam bank. So you really need to focus on the concept itself, and that's what this video does. It introduces the concept, and then we go over a sample question to really help you out with learning that concept. So that's the one I suggest. I have another commenter here saying that they have E&M struggles. Okay, so I have a whole playlist on evaluation and management on the channel too. It is right here. How to code E&M services, part 1, 2, and 3, and 4. The other thing I'll recommend if you're having issues with evaluation and management, my Medicare contractor does an amazing job with their educational products. And they have a lot of workshops coming up soon. And I think some of them are specifically on E&M. So my Medicare contractor is Novitas Solutions, and their information is great. So let's see here. I am in JL, and they have, I'm Part B, physicians and other healthcare professionals, accept terms and conditions, set preference. Excuse me. And here is it under Learning Center or is it under, let's see here. I believe it's under Learning Center. Fee schedules, Learning Center, event calendar. It's a lot easier to register for these events than it used to be, but I believe I saw something coming up on E&M. Ooh, here we go. April 14th, Fundamentals of Evaluation and Management Services, the process of selecting a code. I would sign up for that one as well. I'll drop the link. But yeah, that's on the Novitas website, and that's a great one. They're pretty good at E&M services. The other thing to mention in regards to E&M and the CPC exam is they will have the AAPC calculator available for E&M services during the exam. And you can practice using that prior to your exam. It's not like an exam exclusive. It's not a member exclusive. It is on the AAPC website, I believe, under their resources. Or maybe it's under software and services. Okay, hold on. So I think it's under software and services, calculators and tools. And this E&M calculator is exactly the one that is embedded in the CPC exam. So if you're practicing your evaluation and management, you can start getting familiar with this and practicing your E&M coding with the calculator. And that's the exact resource that you'll have for the exam. So you can put in a data service. Let's say we're coding for an office visit and we have new versus established and we click established. Okay, so it's going to prompt us through the whole medical decision making, and then it's going to spit out the code at the bottom. So that's a great tool to get familiar with because this is the tool that you will have access to for the CPC exam. But yeah, there's lots of different playlists on the YouTube channel. Let me see if I can go back now. I even have one for if you're looking for a medical coding job, all my job search tips, because that's one that comes up a lot as well. So currently, the playlists that I have available are Want to Become a Medical Coder, start here. So all of the introductory information, CPC exam tips. I also have the CPC review. So this kind of follows along with the APC structure for layout. So going through the business of medicine medterm, this is great as to accompany your studies. So let's say you are going through the chapter on the digestive system, read through your chapter, get ready with it, and then refresh with this video here on the digestive system. And it'll help you hone in and go, these are kind of the concepts you should be looking at. There's the job search playlist, case studies, E&M, ICD-10-CM guidelines, tons and tons and tons of shorts. So lots and lots available on the channel. And of course, the shorts we're doing a lot more of the short medical coding demonstrations, little 3-minute snippets of like, here's how to get through this. But yeah, thank you guys so much for tuning in. I should be back next week for more live stream fun. I'm going to head off because it is lunchtime, but I will see you guys in the next video. And until then, just keep on coding on.